Section 3. Pharmacology Study Checklist. 1. 3 areas of pharmacology. It's important to remember that pharmacology includes 3 areas. Pharmacokinetics. This is the study of how medications are absorbed, metabolized, distributed, and excreted by the body. Pharmacokinetics is particularly relevant when it comes to clients with renal or liver disease, or elderly clients who frequently encounter difficulties when it comes to metabolizing and excreting medications. Pharmacodynamics. This is the study of how medications are used by the body. Pharmacotherapeutics. This is the study of how the client responds to the drug. 2. Pharmacology in nursing practice. In nursing practice, nurses are expected to apply their knowledge of pharmacology in order to recognize common uses, side effects, and adverse effects of their client's medication, meet the learning needs of their client, challenge medication errors. Test takers need to remember the medication classifications commonly used in medical and surgical settings and their effects on the body. Antacids. Antacids reduce hydrochloric acid in the stomach. Constipation is a common side effect of calcium and aluminum-based antacids. Diarrhea is a common side effect of magnesium-based antacids. Anti-infectives. Anti-infectives are used to treat infections. A common side effect includes GI upset. Anti-anemics. Anti-anemics increase red blood cell production by increasing the amount of hemoglobin in the blood, or number of red blood cells. B12, iron, and epigen, erythropoietin, are all examples of anti-anemics. Anticholinergics. Anticholinergics are used to induce dryness in mucous membranes, which causes a decrease in oral secretions. Anticholinergics, such as atropine, are often administered prior to operations. Anticoagulants. Anticoagulants prevent the coagulation, i.e. clotting, of blood. They achieve this by preventing platelet aggregation or by decreasing vitamin K levels and blocking the clotting chain. Anticonvulsants. Anticonvulsants are used in the treatment of seizure disorder and of bipolar disorder. Phenobarbital, phenytoin, dilantin, and lorazepam, Ativan, are all medications in this category. Antidiarrheals. Antidiarrheals reduce water content in the intestinal tract and lower gastric motility. Bloating and gas are common side effects. Antihistamines. Antihistamines block the release of histamine during allergic reactions. Signs of dry mouth, drowsiness, and sedation are common side effects caused by antihistamines. Antihypertensives. Antihypertensives lower blood pressure as well as increase blood flow to the myocardium. Orthostatic hypotension is a common side effect. Other side effects may arise which are specific to types of antihypertensive prescribed. Antipyretic. Antipyretics reduce fever. Bronchodilators. Bronchodilators dilate large air passages. They are commonly prescribed for clients who suffer from asthma and chronic obstructive lung disease. Tachycardia is a common side effect. Diuretics. Diuretics decrease the absorption of water and sodium from the loop of Henle, loop diuretics, or inhibit antidiuretic hormone, potassium-sparing diuretics. Hypokalemia is a side effect of non-potassium-sparing diuretics. Laxatives. Laxatives loosen stools and increase bowel movements. Types of laxatives include cathartics, fiber, lubricants, stimulants, and stool softeners. Miotics. Miotics constrict the pupil. Miotics such as pilocarpine HCl are used to treat clients with glaucoma. Mydriatics. Mydriatics dilate the pupils. They are used to treat clients with cataracts. Narcotic analgesics. Narcotic analgesics are drugs that relieve moderate to severe pain. A common side effect is numbness. They can also induce a state of unconsciousness. Opioids, morphine and codeine, synthetic opioids, meperidine, and NSAIDs, ketorolac, are all medications in this category. 3. Administering medications. The 7 rights of administering medication is a checklist that needs to be memorized by every nursing student and nurse. They include 5 rights of drug administration and 2 rights that stem from the patient's Bill of Rights. The 7 rights must be used every time a client is administered a medication by a nurse. The 7 rights of patient medication include 1. The right medication. 2. The right patient. 3. The right dose. 4. The right time. 5. The right route. 6. The right reason. 7. The right documentation. The right medication. The nurse should check both the generic and trade names with the physician's order in order to ensure that the correct medication is administered. In the case that the client's diagnosis does not match the drug category, the nurse must investigate the ordered medication. The right patient. The nurse should take steps to identify the client by checking the identification band and by asking the client to state his name. The right dose. The nurse must know common dosages for both adults and children. The right time. The nurse is expected to administer the medication either 30 minutes before or 30 minutes after the assigned time. The right route. The physician orders the prescribed route of administration. This should be followed provided it complies with formulary guidelines. The right reason and the right to refuse treatment. The client has the right to refuse treatment, which includes medications. If a client refuses medication, the nurse should determine the reasons for refusal. The right documentation. The nurse must always document treatment given to the client. Documentation must be done promptly and accurately to ensure that medication administration is not duplicated. 4. Time-released drugs. Medications that contain one of the abbreviations below are time-released drugs. This means they should under no circumstances be opened, dissolved, or crushed before being administered to the client. Contin, continuous action. CR, continuous release. DUR, duration. LA, long-acting. SA, sustained action. SR, sustained release. Enteric-coated tablets and caplets. These are medications that are coated with a thick shell. This allows for the medication to be absorbed more slowly and prevents the medication from being absorbed in the upper GI tract. Spansules. These are capsules that contain time-released beads that are released slowly. If the client cannot swallow a time-released medication, then the physician should be notified in order to obtain a different preparation for the client. The nurse should never alter the preparation. 5. Drug schedules. Nurses and nursing students must also know the various drug schedules. This will no doubt crop up in questions relating to safety. Schedule 1. Not currently accepted for medical use and are for research use only, for example, LSD. These are drugs with high potential for abuse. Schedule 2. These drugs have a high potential for abuse and therefore require a written prescription for each refill. Examples of drugs under this schedule include narcotics, stimulants, and barbiturates, for example. No telephone renewals are allowed. Schedule 3. These require a new prescription after 6 months or 5 refills. Examples of drugs under this schedule include codeine, steroids, and antidepressants. Can be ordered by telephone. Schedule 4. These require a new prescription after 6 months, e.g. benzodiazepines. Schedule 5. These can be dispensed as any other prescription or without prescription if state law allows. Examples of drugs under this schedule include antidiarrheals and antitussives. 6. Pregnancy categories. One can never say whether it is 100% safe to use a medication on a pregnant client. Because of this, medications are split up into categories of safety by risk level. There are certain categories of medication a pregnant client must avoid, and it is important for a nurse to be aware of these categories. Knowledge of these categories is also likely to be tested on the nclex exam. Category A. The safest drugs to take during pregnancy. No risk to fetus. Category B. Insufficient data to use in pregnancy. Studies for fetal effects in animals have found no risks, but no adequate studies on pregnant women are available. Category C. Potential benefits of medication may warrant use of this medication on pregnant women despite potential risks. Category D. Risk to fetus exists, but potential benefits of the medication could outweigh the probable risks. Category X. There is positive evidence of human fetal risk. Avoid use of these medications in pregnancy or in those who may become pregnant. Potential risks to the fetus outweigh the potential benefits. 7. Herbal remedies. Although herbals are not considered to be medications by some, they do, however, have medicinal properties. On the nclex exam, herbals are included as a subtopic under pharmacology. The following is a list of the most common herbals used and the necessary guidelines a nurse or nursing student should be aware of. Echinacea. Uses: to treat fevers, colds, and urinary tract infections. Reactions: this herbal can potentially interfere with methotrexate, ketoconazole, and immunosuppressive agents. Feverfew. Uses: to treat and prevent migraines, arthritis, and fever. Reactions: this herbal should not be taken in conjunction with aspirin, NSAIDs, Coumadin, thrombolytics, or antiplatelet medications. This is because it will prolong the bleeding time. Ginkgo. Uses: this herbal improves memory and can be used to treat depression. Ginkgo also promotes peripheral circulation. Reactions: this herbal should not be taken with MAO inhibitors, anticoagulants, or antiplatelets. This is because it increases the bleeding time in clients taking NSAIDs, cephalosporins, and valproic acid. Ginkgo should also be avoided by clients with seizure disorders because it can exacerbate seizure activity. Ginseng. Uses. Ginseng is used as an anti-inflammatory. This herbal enhances the immune system, improves mental and physical abilities, and has estrogen effects. Reactions. Ginseng decreases the effects of anticoagulants and NSAIDs. This herbal must be avoided by clients taking corticosteroids. This is because ginseng and corticosteroids, when taken in combination, can result in extremely high levels of corticosteroids. High doses cause liver problems. Clients with hypertension and bipolar disorder must be cautioned regarding the use of ginseng because it can interfere with medications used to treat these disorders. Kava kava. Uses. Kava kava is used to treat insomnia as well as mild muscle aches and pains. Reactions. This herbal increases the effect of central nervous system (CNS) suppressants and decreases those of levodopa. The use of kava kava can also increase the effect of MAOIs and cause liver damage. Ma Huang. Uses. Ma Huang is used for weight loss and to increase energy levels. It is also used to treat asthma and hay fever. Reactions. This herbal increases the effect of MAOIs, cardiac glycosides, theophylline, and sympathomimetics. St. John's wort. Uses. This herbal is used to treat mild to moderate depression. Reactions. St. John's wort increases adverse CNS effects when used with alcohol or antidepressant medications. 8. Understanding and knowing how to identify drugs. Firstly, it is important to understand that drugs have several names. The chemical name. This is usually a number or letter that is indicative of the chemical makeup of the medication. This name is not of much value to a practicing nurse. The generic name. This is the name given to the drug by the company that developed it. It is much safer for a nurse to remember this name because the generic name always remains the same. The trade name. Once a drug has been released to the market for around 4 years, a trade-named medication can be released by another company. While the generic name will stay the same, the trade name will be different. If you can, it is best to remember both the trade and the generic name of a drug. On the exam, the generic name will be given and the trade name may at times be included for further clarification. Roughly 80% of generic drugs within the same category have common syllables. Recognizing and identifying these commonalities will significantly help you study for the NCLEX. The following categories in this section are designed to help you recognize these commonalities in the drug names. This will help you to quickly identify a specific drug and thereby their drug category. 1. Angiotensin-converting enzyme, ACE, inhibitors. Uses. These antihypertensives are used in the treatment of both primary and secondary hypertensions. Reactions. These drugs inhibit conversion of angiotensin I to angiotensin II. Syllable pril. You will notice that all the generic names include the syllable pril. If you see the syllable pril, this is an indication that the medication is an ACE enzyme inhibitor. Examples include benazepril, lotensin, lisinopril, zestril, captopril, capitan, enalapril, vasotec, fosinapril, monopril, moexapril, univasc, quinapril, acupril, ramipril, altase. On top of identifying an ACE inhibitor, it is important that you know and remember the potential side effects and adverse reactions of ACE enzyme inhibitors when working with the drug. Side effects and adverse reactions associated with ACE inhibitors include angioedema, hacking cough, hypotension, nausea and/or vomiting, rashes. Nursing considerations to know and use when working with ACE inhibitors. Monitor the electrolyte levels. Monitor the potassium and creatinine levels. Monitor the vital signs frequently. Monitor the white blood cell count. 2. Angiotensin receptor blockers. Uses. Angiotensin receptor blockers are used to treat primary or secondary hypertension. These drugs are used to treat clients who complain of coughing that can be linked to the use of ACE inhibitors. Reactions. These drugs block vasoconstrictor and aldosterone-secreting angiotensin II. Syllable sartan. When you see the syllable sartan, you'll know that the drug is an angiotensin receptor blocker. Examples include candesartan, Atacand, losartan, Cozar, valsartan, Diovan, and telmisartan, Micardis. Side effects and adverse reactions associated with angiotensin receptor blockers include cough, depression, diarrhea, dizziness, impotence, insomnia, muscle cramps, nausea or vomiting, neutropenia. Nursing interventions to know and use when working with clients that are taking angiotensin receptor blocker agents. Instruct the client to check edema in feet and legs daily. Monitor blood pressure. Monitor BUN. Monitor creatinine. Monitor electrolytes. Monitor hydration status. 3. Anticoagulants. Uses. Anticoagulant drugs are used to treat deep vein myocardial infarction, pulmonary emboly, thrombosis, and thrombolytic disease. These medications are also used after coronary bypass surgery and for other conditions such as those requiring anticoagulation. Reactions. These drugs thin the blood and are therefore used to treat clotting disorders. Syllable parin. When you see the syllable parin, you'll know that the drug is an anticoagulant. Examples include dalteparin sodium, Fragmin, enoxaparin sodium, Lovenox, and heparin sodium, Hepaline. Side effects and adverse reactions associated with anticoagulant drugs include alopecia, bleeding, dermatitis, diarrhea, fever, hematuria, pruritus, stomatitis. Nursing interventions to know and use when working with clients that are taking anticoagulant agents. Check blood studies, hematocrit and occult blood in stool every 3 months. Monitor for signs of bleeding. Monitor for signs of infection. Monitor platelet count. Perform a PTT check on clients using heparin sodium, Hepaline, to evaluate the bleeding time. Therapeutic levels are 1.5 to 2.0 times the control. No specific bleeding time is done for enoxaparin sodium, Lovenox, but platelet levels must be checked for thrombocytopenia. 4. Anti-infectives, aminoglycosides. Uses. These drugs are used to either kill an infectious agent or inhibit it from spreading. Reactions. Anti-infective drugs interfere with the protein synthesis of bacteria, thereby causing the bacteria to die. Anti-infectives are active against some gram-positive organisms and against most aerobic gram-negative bacteria. Note: anti-infectives are often used in the treatment of superinfections, e.g. methicillin-resistant Staphylococcus aureus, MRSA. The symptoms of clients with MRSA include cough, diarrhea, fever, malaise, pain, perineal itching, redness, stomatitis, and swelling. Syllable: syn or mycin. Anti-infectives include bactericidals and bacteriostatics. These drugs end with the syllable syn, and many of them end in mycin. Examples include gentamicin, garamycin, alkomycin, Genoptic, kanamycin, Cantrex, neomycin, Misafradin, streptomycin, Streptomycin, tobramycin, Tobrex, Nebzin, amikacin, Amikin. Side effects and adverse reactions associated with anti-infectives include blood dyscragias, hypotension, nephrotoxicity, ototoxicity, rash, seizures. Nursing interventions to know and use when working with clients that are taking anti-infectives. Obtain history of allergies. Instruct the client to report any changes in renal function, i.e. urinary elimination, or hearing. This is because these drugs can be toxic to the auditory nerve and to the kidney. Monitor for therapeutic levels. Monitor for signs of nephrotoxicity. Monitor for signs of ototoxicity. Monitor a patent IV site. Monitor intake and output. Monitor peak and through levels. Monitor vital signs during intravenous infusion. 5. Antivirals. Uses. Antivirals are used for their antiviral properties. Clients that suffer from AIDS are often treated with either one or a combination of antivirals. Antiviral drugs are also used in the treatment of HSV-1 and HSV-2, chickenpox, shingles, fever blisters, encephalitis, cytomegalovirus, and respiratory syncytial virus, RSV. Reactions. Antivirals inhibit enzymes with a virus, thereby inhibiting viral growth. Syllable vir. When you see the syllable vir, you'll know that the drug is an antiviral. Examples include acyclovir, Zovirax, abacavir, Xiagen, cidofovir, Vistide, indinavir, Crixivan, ritonavir, Norvir, and sequinavir, Inverase, Fortovase. Side effects and adverse reactions associated with antivirals include diarrhea, nausea, aliguria, proteinuria, vaginitis, vomiting. Central nervous side effects are also possible, although these are less common. Tremors, confusion, seizures, severe or sudden anemia. Nursing interventions to know and use when working with clients that are taking antiviral drugs. Be watchful for signs of infection. Instruct the client to report any signs of a rash, as this can be indicative of an allergic reaction. Monitor bowel pattern before and during treatment. Monitor liver profile. Monitor the creatinine level frequently. 6. Benzodiazepines. Anticonvulsants/anti-anxiety drugs. Uses. Benzodiazepines are used for their anti-anxiety or anticonvulsant effects, e.g. to reduce anxiety, to induce relaxation, or to treat or prevent seizures and panic disorders, among other things. Syllable: PAM, PATE, or LAM. When trying to identify benzodiazepines, it is useful to remember that while some contain the syllable PAM, others contain PATE or LAM. All benzodiazepines, however, will contain azo or AZE. Examples include clonazepam, Klonopin, diazepam, Valium, chlordiazepoxide, Librium, lorazepam, Ativan, flurazepam, Dalmane. Side effects and adverse reactions associated with benzodiazepines include ataxia, bradycardia, constipation, depression, diplopia, drowsiness, hypotension, incontinence, lethargy, nausea or vomiting, nystagmus, rash, respiratory depression, restlessness, slurred speech, urinary retention, urticaria. Nursing interventions to know and use when working with benzodiazepines. Monitor respirations. Monitor liver function. Monitor kidney function. Monitor bone marrow function. Monitor for signs of chemical abuse. 7. Beta-adrenergic blockers. Uses. These drugs help lower blood pressure, pulse rate, and cardiac output. Beta-adrenergic blockers are also used in the treatment of migraines and other vascular headaches. Certain preparations of this drug can also be used in the treatment of glaucoma and to prevent myocardial infarctions. Reactions. Beta-adrenergic blockers act by blocking the sympathetic vasomotor response. Syllable: alol. When you see the syllable alol, you'll know that the drug is a beta blocker. Examples include acebutolol, Monotan, Rotrail, Sectrail, atenolol, Tenormin, apoatenol, novoatenol, carvedilol, Coreg, esmolol, Brevibloc, and Toprol XL, metoprolol. On top of being able to identify beta-adrenergic blockers, nurses and nurse students must also know the potential side effects and adverse effects. Side effects and adverse reactions associated with beta-adrenergic blockers include bradycardia, diarrhea, nausea and/or vomiting, orthostatic hypertension, may mask hypoglycemic symptoms. Nursing interventions to know and use when working with clients that are taking beta-adrenergic blockers. Teach the client to taper off the medication, rise slowly, report bradycardia, dizziness, confusion, depression, or any signs of fever. Monitor the client's blood pressure, heart rate, and rhythm. Monitor the client for changes in lab values, BUN, creatinine, protein, that indicate nephrotic syndrome. Monitor the client for signs of edema. The nurse must assess lung sounds for rhonchi and rales. 8. Cholesterol-lowering agents. Uses. Cholesterol-lowering agents are used to reduce cholesterol and triglyceride levels. These drugs are also used to decrease the potential for cardiovascular disease. Note: cholesterol-lowering drugs should not be taken with grapefruit juice. They should be taken at night, and the client must have undergone liver studies prior to taking cholesterol-lowering agents to determine the presence of liver disease. Syllable: vastatin. Caution: do not confuse with statin drugs that are used for their antifungal effects, such as nystatin. When you see the syllable vastatin, you'll know that the drug is a cholesterol-lowering agent. Examples include atorvastatin, Lipitor, fluvastatin, Lescol, lovastatin, Mevacor, pravastatin, Pravachol, simvastatin, Zocor, rosuvastatin, Crestor. Side effects and adverse reactions associated with cholesterol-lowering drugs include alopecia, dyspepsia, headache, liver dysfunction, myalgia, muscle weakness, rash. Nursing interventions to know and use when working with clients that are taking cholesterol-lowering agents. Include a diet low in cholesterol and fat. Instruct the client to report any unexplained muscle soreness or weakness and cola-colored urine to the physician. Monitor cholesterol levels. Monitor for muscle weakness and pain. Monitor liver profile. Monitor renal function. 9. Glucocorticoids. Uses. Glucocorticoids are used to decrease inflammatory responses to allergies and inflammatory diseases, to reduce the possibility of organ plant rejection, and to treat conditions that require suppression of the immune system. These drugs are also used in the treatment of Addison's disease, chronic obstructive pulmonary disease, and immune disorders. Reactions. Glucocorticoids have anti-allergenic, anti-inflammatory, and anti-stress effects. Note: glucocorticoid drugs can cause Cushing's syndrome. Symptoms include buffalo hump, edema, elevated blood glucose levels, hirsutism, moon faces, purple striae, and weight gain. Syllable: sown or court. When you see the syllable sown or court, you'll know that the drug is a glucocorticoid. Examples include prednisolone, delta-cortef, prednisol, prednisolone, prednisone, apoprednisone, deltazone, metacortin, orazone, panisol S, betamethasone, celestone, celestajec, betnazole, dexamethasone, decadron, Daranil, Dexon, mimethazone, Dalalone, cortisone, Cortone, hydrocortisone, Cortef, hydrocortone phosphate, Cortifoam, methylprednisolone, Solucortef, Depomedrol, Depopred, Medrol, Repred, triamcinolone, Amcort, Aristocort, Adelone, Kenalog, triamylone. Side effects and adverse reactions associated with glucocorticoid drugs include acne, bruising, depression, diarrhea, ecchymosis, flushing, hemorrhage, hypertension, hypomania, insomnia, leukocytosis, osteoporosis, petachia, poor wound healing, sweating. Nursing interventions to know and use when working with clients that are taking glucocorticoid drugs. Monitor blood pressure. Monitor for signs of infection. Monitor glucose levels. Weigh the client on a daily basis. 10. Histamine 2 antagonists. Uses. Histamine 2 antagonist drugs are used to decrease acid production and to treat acid reflux, gastric ulcers, and GERD. Reactions. These agents inhibit gastric acids by inhibiting histamine 2 release in the gastric parietal cells. Syllable tadine. When you see the syllable tadine, you'll know that the drug is a histamine 2 antagonist. Examples include cimetidine, Tagamet, famotidine, Pepcid, nizatidine, Axid, and ranitidine, Zantac. Side effects and adverse reactions associated with histamine 2 antagonists include confusion, agranulocytosis, alopecia, bradycardia or tachycardia, diarrhea, galactorrhea, gynecomastia, psychosis, rash, seizures. Nursing interventions to know and use when working with clients that are taking histamine 2 antagonist drugs. Administer the drugs with meals. Cimetidine can be prescribed in one large dose at bedtime. If the client is taking antacids as well as histamine 2 antagonists, make sure the client takes antacids 1 hour before or after taking these medications. Monitor the blood urea nitrogen levels. Sucralfate reduces the effects of histamine 2 receptor blockers. 11. Phenothiazines, antipsychotic/antiemetic drugs. Uses. Phenothiazines are used as antiemetics, neuroleptics, or major tranquilizers. These drugs are used in the treatment of psychosis in clients with schizophrenia. Certain phenothiazine drugs, e.g. Phenergan, promethazine, and compazine, prochlorperazine, are used to treat nausea and vomiting. Note: phenothiazines are irritating to the tissue. Because of this, Z-Track method should be used to administer this drug by intramuscular injection. A client who is allergic to a phenothiazine drug is likely to be allergic to all of them. A client who experiences an allergic reaction, extrapyramidal effects, or any more severe reaction needs to be given cogentin, benztropine mesylate, or Benadryl, diphenhydramine hydrochloride. Syllable zine. When you see the syllable zine, you'll know that the drug is a phenothiazine. Examples include chlorpromazine, Thorazine, prochlorperazine, Compazine, trifluoperazine, Stelazine, promethazine, Phenergan, hydroxyzine, Vistaril, flufenazine, Prolixin. Side effects and adverse reactions associated with phenothiazines include agranulocytosis, drowsiness, dry mouth, extrapyramidal effects, neuroleptic malignant syndrome, orthostatic hypotension, photosensitivity, sedation. Nursing interventions to know and use when working with clients that are taking phenothiazines. Be cautious. Liquid forms of flufenazine, Prolixin, should not be mixed with any beverage containing caffeine, tannates, or pectin due to physical incompatibility. Monitor liver enzymes. Monitor renal function. Protect the client from overexposure to the sun. Protect the drug from light. 12. Proton pump inhibitors. Uses. Proton pump inhibitors are used to treat indigestion, esophagitis, gastric ulcers, and GERD. Reactions. These inhibitors inhibit the hydrogen/potassium ATPase enzyme system, thereby suppressing gastric secretion. Syllable, prozole. When you see the syllable prozole, you'll know that the drug is a proton pump inhibitor. Examples include esomeprazole, Nexium, lansoprazole, Prevacid, pantoprazole, Protonix, and rabeprazole, Acifex. Side effects and adverse reactions associated with proton pump inhibitors include diarrhea, flatulence, headache, hyperglycemia, insomnia, rash. Nursing interventions to know and use when working with clients that are taking proton pump inhibitors. Instruct the client to always take the medication prior to meals. Monitor liver function. Use a filter when administering IV pantoprazole. Don't crush pantoprazole, Protonix. To pass the NCLEX, you will need to learn the specific classification of a drug. Remember that learning these classifications will make studying pharmacology significantly easier. This is because medications within a certain category share the same commonalities. When reviewing for the NCLEX, it is therefore crucial to remember the specific classification of a medication, its actions inside the body, and all associated side effects and adverse effects. How to safely administer a medication within that specific classification. 9. Other useful drug identification clues. Below are some other clues that can assist you in identifying drug types. Caine equals anesthetics, lidocaine. Cal equals calciums, calcimar. Ceph with a pH or F equals cephalosporin, cefatazime. Cillin equals penicillins, ampicillin. Cycline equals tetracycline. Note that tetracycline should never be given to a pregnant woman or small children. Done equals opioids, methadone. MAB equals monoclonal antibodies, palivizumab. Phylline equals bronchodilators, aminophylline. Stigmine equals cholinergics, physostigmine. Looking at the similarities and commonalities between medications will help you to identify a certain type of drug, know their side effects, and the relevant nursing interventions. This will also help you manage and divide the substantial knowledge that you need to successfully pass the test. I encourage you to review this section often to ensure you remember all essential facts and information. Do not worry if you don't feel entirely confident yet. Start testing yourself on realistic practice questions, which you can find in the next section. Go over any questions you get incorrect, working out why, and then improve your knowledge in that specific area. Section 4. Study and Exam Preparation Tips. Studying for the NCLEX is a daunting challenge for every nursing student. Despite this, it is completely manageable, and with the right approach, success can be guaranteed. In preparing for the NCLEX, there are 3 central elements that are the most important: understanding, organization, and practice. This study guide is designed for those who already have a good understanding of nursing practice. Section 3 of the guide is simply designed to refresh your memory and help you retain essential information that you will need to answer the practice questions in Section 2. In this section, we have compiled some essential review strategies that will assist you in effective preparation for the NCLEX. Study tips. Learning the details comes first. Before going through the questions, it is important that you have come to grips with the content that is being tested. Practice questions are designed to test and further your knowledge, and to make sure you know how to answer the questions effectively and successfully. Repetition is key. Memorizing is key when it comes to dealing with conversion factors and laboratory values, among other things. It is therefore useful to devote a set time each day to studying this information. On top of this, we encourage you to make best use of the time you spend commuting by continually going over key points. Repeating information just before you go to sleep also helps you memorize information you find particularly difficult to retain. Test yourself. As the old saying goes, practice is the key to success. The questions presented in this guide are representative of what you should expect in the NCLEX exam. Testing yourself is essential to knowing whether you are well prepared for the exam. Make sure to practice as much as possible, and once you are getting closer to the actual exam, time yourself, allowing approximately 1 minute per question. Learn from your mistakes. If there are questions you haven't answered correctly, then see whether you understand the rationale and go over your revision notes again to make sure you have understood it fully. Make sure to test yourself again on questions that you initially answered incorrectly. All questions in this guide are numbered. Make sure to note down the questions you answered incorrectly and skip forward to those questions next time. Exam tips. These are tips you should apply when you are sitting the exam. Try to also apply these when you are going over practice questions, so it becomes second nature. Read the questions carefully. Being alert is key to successfully passing the NCLEX. Skimming through questions is the mistake most often made. It is crucial to make sure you read the question carefully and that you fully understand what it is the question is asking. If necessary, reword the question in your own words. This often helps in crafting an appropriate answer. Look for keywords. Keywords will help you work through the questions more efficiently. It is also advisable to avoid answers that include keywords such as all, always, every, except, must, never, no, none, and only, because they are rarely correct, as they often limit or qualify the actual correct answer. Use the method of elimination. This is particularly useful if you are not straight away sure which option is the correct answer. Eliminate the answers that are clearly wrong, incorrect, or appear unfit until you cannot eliminate any more. Another tip here is to look out for vague answers. Avoid vague answers, and if you spot one, eliminate it. The true-false test. Treat each option as a true-false question, and choose the option that is the most true. Trust your common sense. Even if you're not 100% sure, knowing that you have studied rigorously and have gained a good knowledge of the content, it is often better to trust your instinct rather than risk running out of time. Even more than instinct, try and use your common sense and reread the question again to see whether there is a key aspect you have overlooked at first sight. Another strategy that you can use is to read the question, answer the question, and pick the option that most closely matches your answer. Look for similar options. Looking for the odd answer is a test strategy that can also prove very useful. See whether the 3 similar options are related to a completely different topic and use the method of elimination and/or the true-false test to narrow down your correct answer. Look for opposite or echo options. If two questions are the opposite of one another, chances are that one of them is correct. Section 5. Final Notes. I'd like to take this opportunity to thank you for downloading this book. I hope you now have a solid foundation, and that this guide has helped you equip yourself with the knowledge to achieving success with the NCLEX exam. My final piece of advice: no matter how diligent you are in your studies, your best learning will come from proactively practicing questions over and over again. I'd recommend revisiting the questions you have found difficult to constantly refresh and build on your knowledge as you progress. I sincerely wish you the best of luck in your exam. Best wishes, Eva Reagan. This has been NCLEX, Pharmacology, the NCLEX Trainer. 100+ specific practice questions and rationales, content review, and strategies for test success. Written by Eva Reagan. Narrated by Elaine Kellner. Copyright 2016 by Eva Reagan. Production copyright 2016 by Eva Reagan.
Audible hopes you have enjoyed this program.